Hey there. I've been curious about healthcare systems in different countries lately. Do you know anything about what the healthcare system is like in Tunisia?
Hi. That's an interesting topic. Tunisia has a unique healthcare system. It's a mix of public and private healthcare providers. Would you like me to explain more about it?
Absolutely. I'd love to learn more. So, you mentioned it's a mix of public and private providers. How does that work exactly?
Well, the public healthcare system in Tunisia is primarily funded through government sources. It provides healthcare services to the majority of the population. The Ministry of Health oversees and manages this system. They operate public hospitals, health centers, and clinics throughout the country, and healthcare is provided to citizens free of charge in these facilities.
That sounds like a comprehensive system. What about the quality of care in these public facilities?
The quality of care in public health care facilities can vary. In larger cities and urban areas, you may find better equipped hospitals with highly trained medical professionals, but in rural areas, the quality of care can be somewhat limited due to resource constraints. Over the years, there have been efforts to improve the infrastructure and quality of care in public facilities.
I see. So, if someone wants higher quality care or faster access to medical services, would they turn to the private sector?
Yes, exactly. The private sector in Tunisia's healthcare system plays a significant role. It includes private hospitals, clinics, and medical practices. Many people who can afford it, as well as those with private health insurance, often prefer to use private health care services. Private facilities are generally well equipped and often provide more specialized care. However, they come with a cost, and not everyone can afford them.
That makes sense. It seems like there's a balance between public and private options. How about health insurance in Tunisia? Is it common?
Health insurance is not mandatory in Tunisia, but it is becoming increasingly popular, especially among the middle and upper classes. Some employers offer health insurance as part of their benefits package, and individuals can also purchase private health insurance plans. These plans can cover a portion of the costs associated with private health care services.
It's interesting to see how the system is evolving. What about access to health care for low-income individuals or those without insurance?
Access to health care can be a challenge for low-income individuals and those without insurance. While public health care is theoretically available to all citizens, the quality and availability of services can be limited in some areas. Additionally, wait times for certain procedures or specialist appointments can be long. Non-governmental organizations and charities also play a role in providing health care services to underserved populations.
That's a common challenge in many countries. Are there any government initiatives to address healthcare disparities or improve access?
Yes, the Tunisian government has taken steps to address healthcare disparities and improve access. They've implemented various health programs and initiatives aimed at expanding healthcare services, particularly in underserved areas. These efforts include infrastructure development, training of healthcare professionals, and increased funding for the public healthcare system.
That's encouraging to hear. Are there any major health issues or concerns that Tunisia is currently grappling with? Like many countries, Tunisia faces several health challenges. Non-communicable diseases, such as diabetes and cardiovascular diseases, are on the rise, driven in part by changing lifestyles. The country also deals with infectious diseases like tuberculosis and hepatitis. Additionally, the healthcare system has faced challenges related to the COVID-19 pandemic, including vaccine distribution and managing the impact on hospitals.
The pandemic has certainly put a strain on healthcare systems worldwide. Speaking of COVID-19, how has Tunisia been managing the pandemic in terms of healthcare response?
Tunisia, like many countries, faced significant challenges during the COVID-19 pandemic. They implemented various measures, including lockdowns and travel restrictions, to curb the spread of the virus. The healthcare system experienced strain at times due to a surge in cases, with hospitals reaching capacity. Efforts were made to increase testing and vaccination, and there was a push for international assistance to secure vaccines and medical supplies. It's been a tough time for healthcare systems everywhere. Hopefully, things are improving. One last question, how does medical education work in Tunisia? Are there opportunities for aspiring healthcare professionals?
Tunisia has several universities and institutions that offer medical education and training. The medical education system is comprehensive, and aspiring healthcare professionals can pursue degrees in medicine, dentistry, pharmacy, and nursing, among others. The Ministry of Higher Education and Scientific Research oversees the accreditation and quality of medical education programs.
That's great to know that there are opportunities for those interested in healthcare careers. Thanks for all the information about Tunisia's healthcare system. It's been really informative.
You're welcome. It's been a pleasure discussing this topic with you. If you have any more questions or want to explore any other aspects of Tunisia's healthcare system, feel free to ask.